I had the great pleasure, and I say that with much facetiousness, to be hospitalized twice in the last year. And no, it wasn't serious, or I wouldn't be standing before you today. But I had the great pleasure of trying on a new wardrobe. I wanted to share that with you. Now, think about how many of you deal with people who have one of these on? Can you just raise your hand? Wow, almost everyone. Okay, now I want you to think about what happens to someone when they put one of these on. It's like there went my self-esteem right out the window. So we have to think about some of the psychological things that are going on with people just when they walk through the door. Before you ever even provide your service, they have mentally gone through somewhat of a transition, which can certainly affect all of our communications with them. So the next time you see one of these, think about how can you bring that person back to the person they were before they put it on. So what I would like for you to do right now, and this is a timed exercise, I'm going to give you 30 seconds at your table to write down as many words as you think would stump me, that I would not know the definition of. I am not a medical person. Go. Will you shout some of those out to me, and we'll see if I have any idea of what they are. BID. Okay, now I know I saw that. That's something to do with what I can or can't have to eat. Is that right? No. Born in Denver. What would that be? Tell me, what is that? I'm sorry? Twice a day. Oh, that's where I've seen it on the little prescription pad. Okay, what's the next one? Okay, now, my mama raised a smart girl. I'm thinking that might be 3 times a day. Yeah, okay, good. I want you to think about where have you been in a situation where you didn't know their lingo. We have to think about how lingo makes someone feel. Sometimes it makes them feel what? Stupid. And stupid tends to make people, because I'm, of course, never going to admit to you that I'm stupid, I will get very what? Defensive, right. Let me tell you a need that I had as a patient that evidently the hospitals I was in had no idea about. I actually need to sleep. Strange concept. Great story was that one evening they actually had me on morphine, and I was not too thrilled about that. I've read enough stories about people getting addicted to painkillers and that, so I thought, I think I'm doing a little bit better. I think I can get off this morphine stuff, only I had a splitting headache. So I called the nurse into the room, and I said, could you get me a Tylenol? She said, well, I can give you morphine. I said, I don't want morphine. I just want Tylenol. I have a headache. Well, it's only written on your chart for morphine. I'm like, look, I had a Tylenol for fever earlier. Couldn't we, go around this a little? Well, would you like me to ask my supervisor? That would be a marvelous idea. And guess what the supervisor said? I could have Tylenol. So that was that half of the story. The best half was 45 minutes later when, by the grace of God, I had entered peaceful rest. She came in and wanted to know if the Tylenol was working. I said, yes, but you may not be living long. Well, I want to ask you what happens before your patient sees a medical provider, because this may have more impact than the actual care that is received. I want you to think about for a moment in your particular area of service, where has your patient been before they actually get to you? And I'm going to give you just a little example of what I'm talking about. I had to go see a physician that I had not seen before. And do you think that sometimes it can be kind of confusing just to even find something in a medical facility if it's large enough? This wasn't even that large of a doctor. It was a physician's office building. And I looked on the little board. It was one of those where, they punch in the little white letters to display what, you need to see. And I looked for the name. Now, I am going blind in my old age, but the letters were pretty big. I think I could have seen it. And so I just thought, well, I think they said it was on the 2nd floor. So I get on the elevator, I go upstairs. I still can't find it. Now, already, is this putting me in almost a negative point of mind? Because was I on time? I know you love people like me who are habitually late. And so I'm nervous about that. Now I'm thinking, now I can't even find the darn thing. And I walk into an office and I say, do you know where Dr. Edelman's office is? And the lady at the desk goes, well, I'm not sure. I think it's on this floor. So I go back outside. I'm looking, is there another sign or anything? I don't even see any other offices. So I walk back in, and instead of going to her, there's another window over here. Same little sitting area. And I said, do you know where Dr. Edelman's office is? Oh, yes, this is his office. They were sharing the same general office. Now, there's a little point to be made here, obviously. If you have new folks going to work for you, take it upon yourself to train them on the important things. And the important things might be as simple as how do I give directions to various physicians or departments. And because all this greatly impacts the impressions of your office or your hospital and the referrals that someone will make to someone else. When I had gone in the hospital, it was kind of over a stomach kind of flu virus thing. And my husband, the family member, is sitting next to me. I'm, looking like death warmed over. And this young, bubbly nurse comes in. She says, hello, how are you today? And I'm like, not good. And he said, oh, yeah, she's kind of not doing really well. He goes, have you seen a lot of this lately? Oh, yeah, we have seen a lot. My dad had it, and we thought he was going to die. Now, I have to confess, as sick as I was, I actually laughed because I thought of folks like you that I would be able to tell that story to. However, if I had been a normal patient, I don't think that would have made my day feel any better. Okay? We have to think about what are we saying. Obviously, there's HIPAA laws and that, but we have to think about even casual comments like that that can totally set service on its ear. Why don't you take a break and get some rest? We'll take care of him while you're gone. I think that's an area where we could be proactive to kind of realize that that family support person is so stressed out. And this is a little bit of a sexist comment, but most often, who do we see as the caregiver sitting there? It's like wife, mother, Think of all the responsibilities that that person not has. Is that the only thing that that man or woman has to do that day is sit there? No, they are so stressed out because they're juggling all their normal responsibilities with that. So I think a recognition of that is very important. And the last one here, tell me about what your dad did before he retired. Think about, how do I make that person in the gown a person?